Our next question will be started with Mr. Carlson. How can government healthcare succeed in the United States when it has failed everywhere else?
Well, we keep coming back to that. I'm glad that we are. I hear people, for instance, I know some people friends of mine from Ethiopia or Somalia, and they were telling me, why can't the United States have a great healthcare system? You get free healthcare system in Ethiopia. And I said, okay, I'm glad to hear that. What kind of healthcare do you get in Ethiopia? And the reason is, it's not something that we would want or that they would want, because obviously they're here, and I think they enjoy our healthcare system much more. So the question is, I asked them, how do you get great healthcare? And the way that you get great healthcare is not by having a basic level of healthcare like Minnesota Care that everybody wants. It's by allowing the people to use their means to get the best health care that they can to protect their health and their loved ones' health and their quality of life. And what this does, as Betty was saying, is that it supports doctors to create better and better health care. And that, therefore, is shared through the dissemination of technology, and we all benefit. So that's why.
Thank you, Ms. Collette.
Would you mind repeating the question, please?
Oh, certainly.
Thank you.
How can government healthcare succeed in the United States when it has failed everywhere else?
I think that's in fact a key point. As Congress was contemplating Obamacare, we were watching the British government decentralize, create more local control over health care. The geographic disparities that Congresswoman McCollum decries are a product of the fact that we've tried to federalize health care. We need to, again, return to a patient-centered health care. The bankruptcies that she decries is because of a lack of catastrophic coverage. That can be remedied without the 2,700-page monstrosity that includes things like small business people having to file 1099s for any expenditures over $600. If you want to see bankruptcies, impose that sort of regulatory and tax burden on small business people.
One of the goals that I brought forward when we were discussing what healthcare should look like for the next generation, so that it was affordable, effective, and accessible, was I was very concerned that we wouldn't create an American system, because I heard people say, do nothing, everything's fine. Well, we knew it wasn't fine. Rates were going up, people were being denied coverage, families were filing bankruptcy. I had people on the left saying, single payer, government run it all. And I wanted to work to come up with a unique American system. And that's what we did. We still have a free market role, substantially enforced now, with small businesses being able to go out and select, compete, and look at the type of coverage that they want and get help for doing it. What is wrong with our system for employers is we have health care based on employees and employers being together. We need to move forward, as Dave Durgenberger keeps talking about, with portable health care. This is a step in that direction, and I'm proud that I'm working on keeping a system that's going to be uniquely American as the front and forethought whenever I look at voting on health care legislation.
Sherry, may I respond to that briefly?
I'd like to too, but you can.
Briefly. We'll give you a 30-second rebuttal.
It's difficult to believe.
Excuse me, and I'd like to ask the moderator.
Yes.
I have been misrepresented, misquoted, and misstated, and I, in the interest of hearing everybody's questions, haven't asked to go back and do corrections. So I just want to know if this is going to be, part of the debate, if I should be asking for that when people paraphrase and put words in my mouth. Or if we're just going to move forward and take questions as
Let's
they
just move
come.
forward, and we can do it at the end then.
Thank you.
Thank you.